believed that the underlying feature of
madam,
this. Yes,
madam, madam, slide of the show
yes.
करनी madam. Slide of show करनी madam.
Hmm?
ଆପଣଙ୍କର ଯୋଉ ସ୍ଲାଇଡ୍ ଅଫ୍ ଟା
ଶୋ
ଶୋ
କରୁନି
କରୁନି। ନାଇଁ ନାଇଁ ମ୍ୟାଡ଼ାମ।
କରୁନି କଲା ବୋଲି କହିଲେ।
ନା ମ୍ୟାଡ଼ାମ।
Yes, ma'am. Here it is shown.
It is showing.
Ma'am. Yes, it is showing here.
Showing. ଦେଖା
Yes,
ଯାଉଛି।
ma'am. ଆଜ୍ଞା।
Yes ମ୍ୟାଡ଼ାମ।
Okay. So the underlying feature is disturbance in mood. These group of disorders, they were commonly called as affective disorders. Affect means emotion. Formally, these disorders were called as affective disorders. They refer to extremes of emotion or affect. That's why they were called affective disorders. They are emotional disturbances consisting of prolonged periods of excessive sadness, excessive joyousness or both. ताମାନେ बहुत दिन धरिकिरी जदि अत्यधिक जड़े दुखी रहिला बा अत्यधिक खुशी रहिला बा उभय रहिला दुखी भी रहिला किछि दिन खुशी भी रहिला ताहले आमे ताकू मूड डिजॉर्डर बोली कहउचंती। आमर जेतबेले इंटेंस सैडनेस is called depression and intense elation is called mania. So these mood states are often conceived to be at opposite ends of a mood continuum. तामाने आमे जदि गोटाए गार काटिबा गोटे मुंडरे रहिबो डिप्रेशन आउ गोटाए मुंडरे गारर रहिबो आउ गोटे एंड रे रहिबो मानिया आउ मझिया मझी हमर नॉर्मल मूड रहिबो। आमे जदि मूड को नेकरी गोटे गार काटिबा some people experience only the depression that is unipolar कहीं ना हमें कहूचे गोटे पोल बा गोटे एंड रे डिप्रेशन आ गोटे एंड रे मानिया तो जति खाली डिप्रेशन जणे एक्सपीरियंस कला ताहले हमें ताकू कहूचे यूनिपोलर माने गोटे पोल ले से रहिला। Some other patients they experience both of these kinds of moods, that is depression and mania, and this second type of disorder is known as bipolar sorry bipolar disorders. Thus mood disorders are categorized as unipolar or bipolar, and depression can also be categorized as originating from a bad or disturbing event in one's life, or depression which appears without any apparent cause. तामाने गोटाकरे कारणटा गोटाए स्पष्ट घटना थिबो जहा पर डिप्रेशन डेवलप करथिबो और से भली किछि माने जानी हला भली घटना न थाई किरी डिप्रेशन होथिबो माने पूरा तांको दुनियाटा खाली पिता पिता लागुथिबे काई कि लागुची से माने जानि पात नथिबे। And mood disorders are also differentiated by severity, that is the number of dysfunctions experienced in various areas of living, and the relative degree of impairment. Second dimension of differentiation is duration, whether the disorder is acute, chronic, or intermittent with periods of relative normal functioning between the episodes of disorder. केते दिन धरिकी रोची ना सब बेले रोची ना मझिरे मझिरे आसी ए नहीं करी मध्य आमे मूड डिजॉर्डर मानन को डिफरेंशिएट करि परिबा. Depression can be categorized as mild, moderate, or severe, major. When we categorize them in terms of severity or duration, they can be mild, moderate, and major depression. Mild depressive disorder is not as serious as the other two versions of depression, that is moderate or major depression. But if this mild depressive disorder, this condition is left untreated, chances are there for the individual to go into severe depression. बढ़ीଯିବ जदि आमे ताको ट्रीट न करिबा. माइल्ड डिप्रेसिव डिजॉर्डर रे कोन देखा जाए सिम्पटम रिड्यूस्ड कंसंट्रेशन, फैटिग एंड स्लीपलेसनेस, फिजिकल प्रॉब्लम्स, लॉस ऑफ इंटरेस्ट, फीलिंग ऑफ गिल्ट एंड वर्थलेसनेस. ए गुडा को सब ए प्रकार रो फीलिंग सब mild depressive disorder देखा जाए. And a form of mild depressive disorder is a dysthymic disorder. Dysthymic disorder. It is a form of mild depression and symptoms typically begin insidiously during adolescence and follow a low grade course over many years of decades. से माने बाहर को एते जना पड़ेनी भीतर भीतर थाए सिम्पटम गुडाक. एंड आमे जन को डिस्थाइमिक डिजॉर्डर हेची कहिबा पई हमको अंततः डिप्रेशन 2 वर्ष बा ताठरू बेसी धरिकी थिबा दरकार. तेणु डायग्नोसिस ऑफ डिस्थाइमिक डिजॉर्डर रिक्वायर्स ए कोर्स ऑफ मोर देन 2 years. And according to DSM-4-TR, dysthymia is an overwhelming yet chronic state of depression. So rahuchi 2 वर्ष धरी रहिलानी. So it is a chronic state of depression exhibited by a depressed mood for most of the days. For more days they are not for at least 2 years. 2 वर्ष धरी अधिकांश दिन तार गोटे स्टेट ऑफ डिप्रेशन ने थिबो. एंड फॉर चिल्ड्रेन एंड एडोलेसेंट आमे तंको पई डायग्नोसिस दबाको आमे देखिबा जे मूड कैन बी इरिटेबल एंड ड्यूरेशन मस्ट बी एट लीस्ट 1 year. छुआ मानक पई 1 वर्ष तार क्राइटेरिया, बट एडल्ट मानक पई 2 years. And at least 2 of the following 6 symptoms must be there. What are these 6 symptoms? Poor appetite or overeating. खाइबा को जमा भोक भोक हो नथबो किबा बहुत गुडे खाउथिबो. Insomnia or hypersomnia. आदौ निद हो नथिबो किबा सोई पारु नथिबो बा बहुत गुडे सोथिबो. Low energy or fatigue, low self-esteem, poor concentration or difficulty in making decisions, and feeling of hopelessness. এই ছটা symptom ভিতরু at least 2 must be present. And another criterion is intermittent periods of normal mood. Periods of normal mood occurring briefly, lasting only for few days or few weeks, maximum 2 मास नेइतबो. जदि ता भीतर से 2 वर्ष आमे गोटा लोक को डायग्नोसिस करिवा पई माइल्ड डिस्थाइमिक डिजर्डर आमर देखा दरकार 2 वर्ष बा ततोधिक काल से अधिकांश दिन तार गोटे डिप्रेस्ड रोथिबो एई 6टा भितरु 2टा अंतत सिम्पटम थिबो एंड ता भितरे मझिरे मझिरे किछि दिन तार टिके नॉर्मल मूड रहुथिबो बट से नॉर्मल मूड जो पीरियड पई रहे सेटा बहुत दिन धरिकिरी रहु नथिबो केते अल्प केते दिन बा केते सप्ताह धरिकिरी रहउथिबो पूरा बेसी दिन धरिकिरी रहु नथिबो 2 वर्ष भीतर अधिकांश दिन त मन खराब थी माने डिप्रेस्ड होथिबो एंड नो मेजर डिप्रेशन विद इन first 2 years of disturbance, no manic, hypomanic or cyclothymic disorder present. तामाने dysthymic disorder होची unipolar. It is a mild unipolar depression disorder. Dysthymia, like major depression, tends to run in families. आमे जदि तार कारण कोन कहिबा माने जे प्राय तो जदि गोटे फैमिली रे बहुत लोग माने तार बापा माँ कर अच्छी से डिजॉर्डर पिला मानकर हबार चांस बहुत बेसी एंड सम सफरर्स डिस्क्राइब बीइंग अंडर क्रॉनिक स्ट्रेस से माने कहती मु बहुत स्ट्रेस रे अछि तेणु एनवायरमेंटल स्ट्रेस इज देयर एंड genetic contribution is also there. Treatment by antidepressant medication is given and psychotherapy is given. Mainly psychotherapy re depression by cognitive therapy is used. Cognitive therapy ro kamo kon na it aims at changing the pessimistic ideas or unrealistic expectations सेई जिनिसटा को बा नेगेटिव सेल्फ इवैल्यूएशन जहाँ माने तार थिबो वर्थलेसनेस सॉफ्टलेसनेस सेई गुडा को चेंज करिबा पई कॉग्निटिव थेरापी इज एसेंशियल एक्चुअली जने डिप्रेसिव पेशेंट रो गोटे ओवरऑल व्यू टुवर्ड्स लाइफ इज नेगेटिव so that should be changed. Then moderate depressive disorder under we can discuss adjustment disorder with depressed mood. Adjustment disorder with depressed mood there kon eko ame reactive depression boli kahu kahi na here it is a reaction to a major life stressor or crisis is there. So diagnosis pai माने हमरो देखिबा दरकार गोटे identifiable stressor is there and symptoms are almost same as mild depressive disorder or dysthymia kintu how can we distinguish between the two how can we distinguish between adjustment disorder and dysthymic disorder first thing mane first difference is in adjustment disorder the depressed mood is a reaction to an identifiable stressor in patient's life निश्चय गोटे स्ट्रेसर अच्छी जोटा को कि आमे जानी परिबा यारी जोगुरु तार होउची एई जोगुरु एटा तार होउची तार चाकरी चली गला सेहि पई से डिप्रेस्ड अछि एई भली जिंस पता घरे तार गोटे क्लोज्ड रिलेटिव के मरि गेले ता पठु तार ये अछि तनो स्ट्रेसर can be identified and secondly duration is different dysthymia adjustment disorder in adjustment disorder the duration of symptoms doesn't exist beyond 6 months 6 मास ठू अधिका जाए नहीं हुए नहीं किंतु सेठी 2 वर्ष बा ताठारु अधिका सिम्पटम थाए तो symptoms moderate adjustment disorder identifiable stressor and duration is 6 months. Treatment, how it is treated, often here symptoms dissipate within 6 months following the end of the stressor that produced the reaction. The our stressor is identifiable. Suppose the problem जोटा stress cause करथिला, the problem is solved. मोर चाकरी नहीं बोली मोर टिके adjust माने depression होची, चाकरीटे मिली गला, तो problem is solved. So symptoms also go away. However, if the symptoms persist because of the relationship between the symptoms and the specific identifiable stressor, treatment puts more emphasis on resolving the problem that created the stress. जो प्रोब्लेमटा स्ट्रेस क्रिएट करूची ताकू सॉल्व करने को ट्रीटमेंट बेसी आमर ट्रीटमेंट मेथड गिव्स एम्फासिस. They may involve making concrete changes in the way the person manages his or her life and may require specific action and decision making for it. से आमर स्ट्रेस होची
Ma'am, you are not audible.
Am I audible now?
Yes, ma'am.
Okay. Is the screen visible?
Yes, ma'am.
Okay. Let us continue. Then let us discuss about major depressive disorder. Um, Major depressive disorder, commonly called major depression, it is unipolar depression, and we also call it as clinical depression. ଏମିତି ତ ଆମ ସମସ୍ତଙ୍କର ମଝିରେ ମଝିରେ କିଛି ସମୟରେ ମନ ଦୁଃଖ ହୁଏ ନାହିଁ କି ଆମେ ଦୁଃଖିତ ରହେନି କି, କିନ୍ତୁ डिप्रेशन क्राइटेरिया मीट करिले ताकू क्लिनिकल डिप्रेशन कहती. The person exhibits more symptoms than are required for dysthymia. So in major depression, it is more severe and symptoms are more in number than that in dysthymia. Symptoms are more persistent, so duration is also longer and symptoms are more persistent. That is, there is no intermittent period of normal mood. Dysthymia re intermittent period of normal mood मझिरे मझिरे टिके किछि दिन अल्प किछि दिन पई नॉर्मल मूड ही थाई पारे, बट मेजर डिप्रेसिव डिसऑर्डर रे there is no intermittent period of normal mood. The person usually exhibits a very low mood which pervades all aspects of life and an inability to experience pleasure in activities that were formerly enjoyed. Suppose मते सिनेमा देखिबा को आगुरु भल लागुथिला किंतु वर्तमान ओ सिनेमा भल लागुनी, मते बुलाबुली करबा को आगुरु भल लागुथिला किंतु एबे आ मो बुलाबुली एन्जॉय करि परनी. तेणु जो एक्टिविटी गुडा को previously the person used to enjoy, now he or she cannot enjoy those activities. Major depressive disorder may be of single episode or recurrent. Recurrent means more than one discrete episodes of at least 2 weeks duration. बारंबार तार होथिबो. Diagnostic criteria. The DSM-4 lists 9 symptoms, out of which 5 must be present, at least 5 or more must be present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either a depressed mood or loss of interest or pleasure. मन दुखरे बहुत दुखरे रहिला बा कौनसी थिरे आग्रह लागुनी किछि कौनसी थिरे मो खुशी पाउनी, ताको अनहेडोनिक कहंती, अनहेडोनिया. And at least 5 or more must be present. So, out of 9 symptoms. What are these 9 symptoms? Depressed mood most of the day, nearly every day. सेटा आमे केमती जानिबा तार डिप्रेस्ड मूड रे अछि, as indicated by either subjective report, से लोक निजे कहि पारे मते मूड डिप्रेस्ड होउची, बा ऑब्जर्वेशन मेड बाय अदर्स, तार जे फ्रेंड्स फैमिली फ्रेंड्स एमाने कहउतिबे से सब बेले ये रे तार ई चेंजटा से माने कहिबे. Second, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. प्राय प्रत्येक दिन तार कौनसी थ्रू से किछि खुशी पाउ नथिबो. Third, significant weight loss when not dieting or weight gain. आमे जदि डाएटिंग करूचे खाइबा ये रे कंट्रोल करचे जा करचे ताहले हमर वेट लॉस हेई पारे, किंतु जदि मेजर डिप्रेशन अछि डाएटिंग न करी करी मध्य significant weight loss will be there or weight gain can also be there. ହେଇ ପାରେ or decrease or increase in appetite nearly every day. ଆମର ଭୋକଟା କମି ଯାଇପାରେ ବଢି ଯାଇପାରେ ମଧ୍ୟ। ଦେନ୍ ଫୋର୍ଥ କ୍ରାଇଟେରିଆ ହଉଛି ଇନସୋମନିଆ ଅର୍ ହାଇପରସୋମନିଆ ନିୟରଲି ଏଭ୍ରି ଡେ। ଇନସୋମନିଆ ହଉଛି inability to sleep, lack of sleep, hypersomnia ବହୁତ ଗୁଡେ ସମୟ ଆମେ ଶୋଇବା। ଫିଫ୍ଥ ସାଇକୋମୋଟର ଏଜିଟେସନ ଅର୍ ରିଟାର୍ଡେସନ ନିୟରଲି ଏଭ୍ରି ଡେ। ଏଇଟା ମଧ୍ୟ ଅବଜର୍ଭେବଲ ବାଇ ଅଦର୍ସ। ଅନ୍ୟମାନେ ଦେଖିକିରି ବି କହୁଥିବେ ଯେ ସେ ଲୋକଟା ଭାରି ରେଷ୍ଟଲେସ୍ ରହୁଛି, ଜମା ସ୍ଲୋ ଡାଉନ୍ ହଉନି, ବା କିଛି କାମ ଦାମ ନ କରିକିରି ଖାଲିଟାରେ ବସୁଛି। ତେଣୁ ଅନ୍ୟମାନେ ମଧ୍ୟ କହିବା ଦରକାର ସବଜେକ୍ଟିଭ ଫିଲିଂ ସହିତ। ୟୁଜୁଆଲି ଏଇଟା ସବଜେକ୍ଟିଭ ଫିଲିଂ ଏତେ ଜଣେ ଜାଣିପାରିବନି କହିବନି, ଅନ୍ୟମାନେ ଅବଜର୍ଭ କରିକିରି କହିବେ। 6 fatigue or loss of energy nearly every day. 7 feeling of worthlessness or excessive or inappropriate guilt. 8 diminished ability to think or concentrate or indecisiveness nearly every day. 9 recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicidal attempt, or a specific plan for committing suicide. ସବୁବେଳେ ସୁଇସାଇଡ୍ କରିଦେବି ବୋଲି ଭାବୁଥିବ ବା ପ୍ଲାନ୍ କରୁଥିବ, ମୁଁ ଏମିତି ଯାଇ ଏଠି ଯାଇ ଟ୍ରେନ୍ ତଳେ ଶୋଇପଡ଼ିବି ବା ଏମିତି ଝୁଲି ପଡ଼ିବି, ତାର ପ୍ଲାନ୍ କରୁଥିବ ସୁଇସାଇଡ୍ କରିବାକୁ, ବା ଆଟେମ୍ପ୍ଟ ମଧ୍ୟ ନେଉଥିବ, ସୁଇସାଇଡ୍ କରିବା ପାଇଁ ଆଟେମ୍ପ୍ଟ ମଧ୍ୟ ନେଉଥିବ। ତେଣୁ ଏଇ ସୁଇସାଇଡ୍ ପ୍ଲାନ୍ଟା ରେକରେଣ୍ଟ ହେଉଥିବ, ବାରମ୍ବାର ଆସୁଥିବ। ତାପରେ ଅନ୍ୟ କ୍ରାଇଟେରିଆ ହେଲା ଦି ସିମ୍ପଟମ୍ସ କଜ୍ କ୍ଲିନିକାଲି ସିଗ୍ନିଫିକାଣ୍ଟ ଡିଷ୍ଟ୍ରେସ୍ ଅର୍ ଇମ୍ପେୟାରମେଣ୍ଟ ଇନ୍ ସୋସିଆଲ ଅକୁପେସନାଲ ଅର୍ ଅଦର ଇମ୍ପୋର୍ଟାଣ୍ଟ ଏରିଆଜ ଅଫ୍ ଫଙ୍କସନିଂ। ଆଉ ଦି ଏପିସୋଡ ଇଜ୍ ନଟ୍ ଆଟ୍ରିବ୍ୟୁଟେବୁଲ ଟୁ ଦ ଫିଜିଓଲୋଜିକାଲ ଇଫେକ୍ଟସ୍ ଅଫ୍ ଏ ସବଷ୍ଟାନ୍ସ ଅର୍ ଆନଦର ମେଡିକାଲ କଣ୍ଡିସନ। ମେଡିସିନ ଫେଡିସିନ ଅଣ୍ଡରରେ ବା ଅନ୍ୟ କୌଣସି ଡିଜିଜ୍ ହେଇକିରି ଏ ପ୍ରକାର ସେ ସିମ୍ପଟମ୍ ହେଉନଥିବ। ଆଚ୍ଛା, there are several specifiers of subtypes of major depressive disorder. କ'ଣ subtype ସବୁ? Atypical depression. Atypical depression is characterized by mood reactivity, that is paradoxical anhedonia. ମନେକର ତମର ମନରେ କିଛି ଭଲ ଲାଗୁନି, ତା ଭିତରେ ମଧ୍ୟ ତମେ ଗୋଟେ ଖୁସିରେ କ'ଣ ଗୋଟେ କରିଦଉଛ, ସେଇଭଳି ଗୋଟେ ପାରାଡକ୍ସିକାଲ ଜିନିଷ। ମେଲାଙ୍କୋଲିକ ଡିପ୍ରେସନ, ଲସ୍ ଅଫ୍ ପ୍ଲେଜର ଇନ୍ ମୋଷ୍ଟ ଅର୍ ଅଲ୍ ଆକ୍ଟିଭିଟିଜ, ଏ ଫେଲିଓର ଅଫ୍ ରିଆକ୍ଟିଭିଟି ଟୁ ପ୍ଲେଜରେବୁଲ ଷ୍ଟିମୁଲାଇ। ତାକୁ ଯେତେ ହସେଇଲେ କି ଭଲ ଲାଗିବା ଜିନିଷ ଦେଲେ ବି ସେ କିଛି ତାର ରିଆକ୍ସନ ନଥାଏ। Catatonic depression is a rare and severe form of major depression involving disturbances of motor behavior and other symptoms. ମୋଟର ବିହେଭିୟର ଏମିତି କି ଆଦୌ ନ ଦେଖେଇ ପାରେ, ଏକଦମ ଇମୋବାଇଲ ହେଇକିରି ସେ ଲୋକ ରହିପାରେ, ବା ଷ୍ଟୁପରସ୍ ମାନେ ତାକୁ ଯେତେ କେଚିଲେ ମାନେ ଇ କଲେ ମଧ୍ୟ ସେ ତାଠି ରିଆକ୍ସନ ହବା ବହୁତ କଷ୍ଟ, ଯଦି ବି ହବ ଗୋଟେ ଦିଟା ମୁହୂର୍ତ୍ତ ପାଇଁ। ତ କ୍ୟାଟାଟୋନିକ ଷ୍ଟୁପର ମାନେ ସେ ଗୋଟିଏ ବାଗରେ ସେ ପୁରା ଇମୋବାଇଲ ହେଇକିରି ରହିବ। Psychotic major depression, it is a psychotic depression where the patient experiences psychotic symptoms such as delusion, hallucination, jadio hallucination is not frequently experienced, but a delusion is experienced. Another subtype is postpartum depression. Postpartum depression होची after माने स्त्री लोक माने after giving birth to a child, sometimes experience intense sustained and disabling depression following the few days within the few days of giving birth to a child. Women suffer from some women suffer from postpartum depression. And the last variety is seasonal affective disorder. Seasonal affective disorder is also known as winter depression or winter blues. This seasonal affective disorder so je seasonal pattern कौन ना with depressive episodes coming on in the autumn or winter. आमर शरत ऋतु सरी सरी आसुव शीत ऋतु आरंभ हम से ही समय रे तार डिप्रेसिव सिम्पटम गुड़ाक देखा जाए एंड स्प्रिंग आसिला बेलू सेटा चली जाए से ये गुड़ा ताकू ये जिनस गुड़ाक प्रायतः आमर जो नॉर्दर्न अल्टीट्यूड रे मेरु अंचल रे जो कि शीत दिने नाइट इज वेरी लॉन्ग डे इज वेरी शॉर्ट एमती को जगह मस मस धरिक राति थाए तो सनलाइट इज नॉट देयर से जगार सीजनल अफेक्टिव डिजॉर्डर बेसी देखा जाए शीत दिने because sunlight is not there. So sunlight is very light is very important for the maintenance of our mood and emanku actually treat madhya kara jaye light therapy deikiri प्रिभालेंस जदि देखिबा फ्रीक्वेंसी ऑफ मेजर मूड डिजॉर्डर बहुत अलार्मिंग मध्य तार लाइफ टाइम प्रिभालेंस होची 70% एंड 1 ईयर प्रिभालेंस होची 7% ऑफ जनरल पॉपुलेशन लाइफ टाइम प्रिभालेंस कोन ना माने लोक माने तांको जीवन काल भितरे केते बेले हेले मध्य एई भली तांकर एक्सपीरियंस डिप्रेशन सफर करिथिबे सेटा होची लाइफ टाइम प्रिभालेंस मन कर मोर डिप्रेशन 2 वर्ष तळे थिला वर्तमान किंतु मु आई एम ओके नाही ठीक ठाक अछि ताहले लाइफ टाइम प्रिभालेंस मोर भीतर जो गणा होची ता भीतर मु आसीबी बट 1 ईयर प्रिभालेंस हला गला वर्षक भितर जो वर्ष चली गला वर्षक भितर कहार से सिम्पटम सब अच्छी तो मु जहाँ कहली मन कर 2 वर्ष 3 वर्ष तले मोर डिप्रेशन होता किंतु वर्तमान नहीं सो मोर 1 ईयर प्रिभालेंस से आमे कंसीडर करछे आई विल नॉट बी इंक्लूडेड इनटू दैट कैटेगरी बुझियला कि एंड major depressive disorder is higher among women than in men प्राय रेशियो होची 2:1 स्त्री लोकों को बेसी डिप्रेशन हुए what are the causal factors we have discussed the diathesis stress model diathesis कोन गोटे प्री एक्जिस्टिंग vulnerability सेटा को डायथेसिस कहंती तेणु डायथेसिस गोटे vulnerability थिबो माने दी गोटे प्रोननेस थिबो the person must have a vulnerability towards the disorder which is activated by stressful life event. So both diathesis and stress dita jako mane interact with each other to result in that disorder. So the diathesis is activated by stressful life events and vulnerability can be genetic or schematic. Schematic माने तमरा genetic तो बुझी पारुथिबो तमरा ये हेई थाई पारे जीन role or other biological ମାନେ ଇଏ ଥାଇପାରେ ମଧ୍ୟ, କିନ୍ତୁ ଜେନେଟିକ୍ ଥିବ, ଜିନ୍ ର କଣ୍ଟ୍ରିବ୍ୟୁସନ୍ ଥିବ, ଆଉ ସ୍କିମାଟିକ୍ ଡାଇଥେସିସ୍ ହେଲା ସେ ପର୍ସନ ଓଭରଅଲ୍ ପର୍ସପେକ୍ଟିଭ ଟୁୱାର୍ଡସ୍ ଲାଇଫ୍ ওটা ଗୋଟେ ନେଗେଟିଭ ଥିବ, ସୋ ନେଗେଟିଭ ଭ୍ୟୁ ଅଫ୍ ଲାଇଫ୍। ତ ଜେନେଟିକ୍ ଇନଫ୍ଲୁଏନ୍ସ କ'ଣ? ଏଭିଡେନ୍ସ ଫ୍ରମ୍ ଫ୍ୟାମିଲି ଷ୍ଟଡିଜ୍, twin studies and adoption studies, moderate genetic contribution has been evident. Moderate level of contribution achi gene. So, particularly what a specific gene involved in reuptake of serotonin is involved. Reuptake of serotonin mane amara neural transmission pai neurotransmitter mane within the neuron to electrical impulse टा travel करे in form of electric charges, and between the neurons it is chemical in nature. The neurotransmitters help in neural transmission between the neurons. दीटा न्यूरॉन मझिरे से माने पूरा पूरी कनेक्टेड न थांती, गोटे गैप थाए जाको सिनाप्टिक गैप बा सिनाप्स बोली कहती, से गैप टा ट्रैवल करिबा पई हमर न्यूरोट्रांसमीटर रोल थाए। विभिन्न प्रकार न्यूरोट्रांसमीटर अछि। न्यूरोट्रांसमीटर माने करो न्यूरॉन नंबर 1 और न्यूरॉन नंबर 2 तमे पढ़ी थिबो बोधे, पढ़ी छ ना न्यूरल ट्रांसमिशन?
हाँ मैम।
हाँ, तो न्यूरल रीअपटेक ऑफ न्यूरोट्रांसमीटर कौन ना, न्यूरॉन 1 माने कर न्यूरोट्रांसमीटर इज रिलीज्ड, न्यूरॉन 2 रो सेगुड़ाक से माने जेमती हमर रिसेप्टर साइट थिबे, पर्टिकुलर न्यूरॉन पई से रिसेप्टर साइट टा सेंसिटिव थिबो, सी ताकू से माने न्यूरॉन सॉरी न्यूरोट्रांसमीटर released from first neuron must be fitting to the receptor site of the second neuron. तो मन कर first neuron secretes serotonin, तो सही serotonin टा second neuron receptor site सब serotonin fit in हे जिबा दरकार, fit in हे गले पुणी neural impulse आगु को ट्रांसमिटेड हेबो। किंतु बहुत समय कौन हुए ना सेरोटोनिन सिक्रेशन टा मन कर बहुत बेसी हे गला बा जहाँ सिक्रेशन हैला एपटर न्यूरो रिसेप्टर साइट ताको एक्सेप्ट कलानी, ग्रहण कलानी, सेटा फिट इन हैला नहीं, ताले से जो सेरोटोनिन गुड़ाक सिक्रेटेड हो जाइए सेटा जदि कौन हम भर्ती माने कौन से गैप टा फिल होकर पूरा बहुत अनंत काल तेणु सेठी से सेरोटोनिन रीअपटेक हो जाए एक्स्ट्रा सेरोटोनिन गुड़ाक फास्ट न्यूरॉन को पुणी से माने नहीं जाती, और दैट सेरोटोनिन इज मेटाबोलाइज्ड, भांगी जाए मेटा माने ब्रेक डाउन तार कौन हो जाए थ्रू द प्रोसेस ऑफ मेटाबॉलिज्म। तो से सेरोटोनिन जदि रीअपटेक हैला नहीं, sorry, the particular gene involved in reuptake of serotonin गोटे अच्छे माने has been discovered. Serotonin is one of the key neurotransmitters involved in depression. So decreased level of serotonin is associated with clinical depression. सेरोटोनिन लेवल टिके माने कम हेले सिक्रेशन कम हेले डिप्रेशन हुए, तामाने सेरोटोनिन रीअपटेक हेई पारु नहीं, माने सेरोटोनिन गुड़ाक कौन हम ब्रेकडाउन करी जाउचंती, ब्रेकडाउन करी गले serotonin level कमी जीवो. So serotonin level कमिले depression हुए. Cognitive diathesis है negative view of life जहाँ कहली, and according to Seligman, depression in humans is similar to learned helplessness in laboratory animals. सेलिगमैन जो एक्सपेरिमेंट थिला से लैबोरेटरी रे एनिमल मानकू रखिले एभली भाव में रखिले गोटे पादरे शॉक देले से शॉक देला मात्रे से गोटे वॉल टाइप रो थिबो एनिमल could jump to the other side of that compartment. जदि डेई पड़िला other side को चली गला and that wall can be माने से jump करि परिबो सेतिके चली गले आउ शॉक दिया जीवो नहीं किंतु से एनिमल शॉक इज पेनफुल शॉक खाउ थिबे एंड से जानती वेल माने वेरी वेल जे से माने डेई पड़िले शॉक रु रक्षा पाइबे बट से माने शॉक दियंती नहीं शॉक खाई करी से पड़ी इट शॉक्ड आउट अनप्लीजेंट स्टिमुलाई से माने तणु शॉक खाई करी सेठी बड़ हेल्पलेस हेई करी काकुस्ती आई करी रहती तणु से अकॉर्डिंग टू सेलिगमैन डिप्रेशन कंडीशन होची सेही भली गोटे कंडीशन माने आमे आमर सिचुएशन को बदलई दे पारिबा so that we can escape, we are able to escape, but we do not because we think that we have learned earlier that we have no control over the situation. जहाँ घटी जाउची मु कोन बदलई परिबी एई भली किंतु माने we have the ability to change the situation. See, it is learned helplessness. We learn that helplessness. According to Bandura, negative self-concept and a lack of self-efficacy. Self-efficacy kono na got a belief that we can influence events or we can achieve personal goals. We will be successful in achieving personal goal. That is self-efficacy. So negative self-concept or lack of self-efficacy thile, the person will negative self-concept and lack of self-efficacy is associated with depression. And Bowlby's attachment theory predicts a relationship between depressive disorder in adulthood and the quality of the earlier bond between the infant and their adult caregiver. adult माने caregiver और infant भितरे जदि गोटे सिक्योर अटैचमेंट स्टाइल न होला तो गोटे अवॉइडेंट attachment style रहिला then it may lead to depressive disorder in adulthood. And there are social diatheses also. Social diatheses include poverty, social isolation, child abuse, etc. And the diathesis stress model says that the diathesis, diethetic vulnerability is there and it interacts with stressful life events. So stress is also stressful life events are strongly associated with the onset of major depressive episodes. And we can treat this major depressive disorder. Medication can also be given, and cognitive behavior therapy, interpersonal psychotherapy, etc. can be administered. Cognitive behavior therapy mainly कौन होची तो cognitive behavior therapy has two component तमरो पढ़ा होतिबो therapy रे गोटे होची first component change in cognition is attempted and behavioral component रे better coping techniques are taught. So जो गोटे negative perspective negative view of life को change करा जाए और better coping strategies are learned. Then bipolar disorder. Bipolar, as the name suggests, involves both the poles, that is depression and mania. So bipolar disorder is characterized by presence of manic or hypomaniac symptoms along with depressive symptoms. Each may be separated by periods of normal mood. ତେଣୁ depression ଥିବ, manic or hypomaniac symptom ଥିବ. Let us discuss what are the depressive episodes. Depressive episode has features typical of major depression. ଆମେ ଯାହା major depression ରେ discuss କଲେ ସେଇଭଳି symptom ସବୁ depressive ଇଏରେ ଥିବ. So including depressed mood, anhedonia, anhedonia ମାନେ inability to find pleasure from the activities जो activity गुड़ाक कि once you were used to enjoy. Psychomotor retardation जो विशेष activity रे करबनी कम हेकि रहइबो and feelings of pessimism and guilt. Sleeping and eating often माने कमी पारे और increase मध्य करि पारे. Manic episode कौन? A manic episode is defined as one or more than 1 week of persistently elevated, expansive or irritable mood plus 3 or more than 3 of the following additional symptoms. कौन से symptom गुड़ा तो ऐसे माने होची inflated self esteem और grandiosity, निजुको गोटे बहुत माने मु सब किछि कर देई परिबी, गोटे भारी माने talented ଆଉ ଭଲ ଭାରି ବୁଦ୍ଧିଆ ବହୁତ ପରିବାର ବୋଲି ଭାବିବା. Decreased need for sleep, ଶୋଇବାର ଆବଶ୍ୟକତା ନିଦ ଫିଦ ଲାଗିବନି. Greater talkativeness than usually ଗୋଟେ ଲୋକ ଯେତିକି କଥା କହେ ବହୁତ କଥା କହୁଥିବ. Persistent elevation of mood, ଗୋଟେ elevated mood ରେ ଥିବ, depressed mood ରେ ନଥିବ. Flight of ideas or racing of thoughts, ବହୁତ ପ୍ରକାରର idea ଆଉ thought ଆସୁଥିବ ଖାଲି. Distractibility and increased goal directed activity. ଏଇ ଭଳି symptom ସବୁ ଥିବ. So manic episode ରେ କ'ଣ ହେଇଥିବ, persistently ଗୋଟେ elevated mood ଥିବ for continuously for 1 week. ଗୋଟେ week ପାଇଁ ଏଇ ସବୁ symptom ଦେଖା ଦଉଥିବ. ଏଇ ଯେତେ ଗୁଡେ କହିଲି ତା ଦେହରୁ କିଛିଟା ଦେଖା ଦଉଥିବ, 3ଟା ବା ତାଠୁ ଅଧିକା, ଅତି କମରେ 3ଟା ଦେଖା ଦଉଥିବ. Manic patients may inexhaustibly, excessively and impulsively involved in various pleasurable high risk activities. बहुत समय से माने manic episode जतବେଳେ थाए से लोक गुड़ाक जो गुड़ाकरे रिस्क बहुत गोटे मूडटा तो भारी एलिवेटेड हेकरी थाए ना, तो गैम्बलिंग, डेंजरस स्पोर्ट्स एई भली ये से माने मातंती जहाँ हो जाऊ से भली without insight into the possible harm. से कौन हम consequence से कथा भाभी पारंतिनी किंतु माती जाती. Hypomaniac episode कौन ना, ये hypomaniac episode is less extreme variant of mania. Mania जते extreme लेवल ऑफ इलेशन जो जहाँ ये हाइपोमानिया हूँ लेस एक्सट्रीम and hypomaniac episode involves a distinct episode that lasts 4 or more than 4 days अति कम रे 4 दिन थिबो 7 दिन थिले कौन मैनिक एपिसोड 7 दिन लगी रहे किंतु हाइपोमानियाक 4 दिन पाई रहिबो आउ किंतु एते दूर मानियाक भली नुह किंतु तार पेशेंट रो यूजुअल नॉन डिप्रेस्ड मूड रे जेतिकी से जेमती रहे ताठू अधिका गोटे एलिवेटेड हेकरी थिबो
Excuse ma'am,
Yes.
which episode is more dangerous, depressive episode or manic episode?
उभय डेंजरस डिप्रेसिव एपिसोड रे बेले बेले से माने मनिकर खाइलेनी पीलेनी पूरा जबरदस्त माने इमोबाइल हेकरी रहिले सेठी पोस्ट फीडिंग दरकार से बंचिबो केमिति तेणु से भली हेकरी ये हेबे मैनिक एपिसोड रे मध्य तमर से लोक जमा रेस्ट नबनी सोइबनी गोडे ये होतिबो रिस्क टेकिंग बिहेवियर गुडाकरे माति जाउतिबो सेथरे मध्य डेंजर
He is showing more happy in manic episode na
happy माने गोटे इलेटेड मूड रे थिबो गोटे हस खुशिया ये रे हैप्पीनेस ट्रू सेंस रे हमें कहि परिबानी गोटे माति थिबो ये रे गुडाई कथा कहउथिबो गुडाई काम करूथिबो ए भली आ हैप्पी पई कहबा को त हमें कहि परिबा हमें कोन टिके कंट्रोल मझी मझिया थाई करी भी हैप्पी हेई परिबानी
Yes ma'am.
And mixed episode can also be there. Mixed episode रे कौन हुए mixed episode blends depressive and maniac or hypomaniac features उभय को रो फीचर थाए तो केमिति ना द क्राइटेरिया फॉर बोथ mania and depression are met. For example, patients may momentarily switch to tearfulness during the height of mania. और भारी मोटिवेटेड हेकरी कोन करथिबो सेई भीतर पुणी कांदी पकोउथिबो दुखित होई जाउथिबो सेटा होची मिक्स्ड एपिसोड ओके तो आमर मेनली मैनिक एपिसोड ता 7 दिन पे ये करे आउ हाइपोमानिया को गुडा को 4 दिन आउ तांकर लेस एक्सट्रीम माने लेवल so bipolar disorder there are several types first होची bipolar 1 disorder bipolar 1 disorder रे कोन ना presence of manic or mixed episodes lasting for at least 7 days so severe that the patient needs immediate hospital care बहुत सिवियर हेकरी मानिक ये थिबो प्रेजेंस ऑफ मेजर डिप्रेसिव एपिसोड टिपिकली लास्टिंग फॉर 2 वीक्स आमे डिस्कस करछे मेजर डिप्रेसिव एपिसोड 2 सप्ताह एंड मानिक ये होची 7 दिन तारो से थिबो एंड सिम्पटम्स ऑफ मानिया और डिप्रेशन must be a major change from the person's normal behavior जेति की नॉर्मली तार नॉर्मल मोड रे जेति की से इलेटेड थाए बा जेति की तार एक्टिविटी लेवल थाए ताठू अधिका होथिबो ओटे चेंज होथिबो अधिका that is bipolar 1 then bipolar 2 disorder in bipolar 2 disorder full blown manic episodes are not experienced experience of clear cut hypomaniac episode जोड़ा को कि less severe with major depressive episode. Major depressive episode thiba au episodes of hypomania case episode thiba सेटा bipolar 2 disorder रे किंतु maniac episode नथिबो. Bipolar 2 is more difficult to diagnose. Kahinki? Now, since the hypomaniac episode may simply appear as a period of successful high productivity, हाँ लोकटा टिके खुशी अछि आ कोन गोटे सक्सेसफुल हे जाइछि गोटे भलो पेपर पाई जाइछि कि परीक्षा रे भलो भलो करिछि सेहि पय भारी खुशी अछि आ तेणु आमे तार हाइपोमानियाक एपिसोड को सेही भली कहि परिबा. Then third type is, however, careful observation in bipolar 2 disorder, careful observations of their behavior can report the erratic behavior they show. प्रथमरु माने हाइपोमानियाक एपिसोड एते ऑब्जर्वेबल न हेले मध्य आमे जदि केयरफुली ऑब्जर्व करिबा तार एराटिक एसोसिएटेड एराटिक बिहेवियर गुडा वी कैन ऑब्जर्व नोटिस. Third type is cyclothymia or cyclothymic disorder. It is a mild form of bipolar disorder. Patients have episodes of hypomania that shift back and forth with mild depression for at least 2 years. So depression is not major, it is mild depression and ये गोटे हाइपोमानियाक पीरियड मध्य थिबो. सो देयर इज कोन चेंज बिटवीन हाइपोमानिया एंड mild depression, and that must occur for 2 years, at least 2 years. And fourth variety of bipolar disorder is bipolar disorder not otherwise specified. A person has symptoms of the illness that do not meet diagnostic criteria for either bipolar 1 or 2. ताहले जदि आमे स्पष्ट भावे बाइपोलार 1 बा बाइपोलार 2 भावरे मानको डायग्नोज करि न पारुचे ताहले आमे ताकू कहिबा किंतु सिम्पटम अछि से सिम्पटम गुडा को क्लियरली बाइपोलार 1 और 2 बोली कहि हो नाही. We would say that this is bipolar disorder not otherwise specified. The symptoms may not last long enough, or the person may have too few symptoms to be diagnosed with bipolar 1 or 2. However, the symptoms are clearly out of the person's normal range of behavior. Causal factors include biological factors. Heritability of bipolar disorder is 0.71, and the role of neurotransmitters are also there. One explanation, that is catecholamine hypothesis, says that depression is associated with low levels of norepinephrine. Conversely, mania is associated with an excess of noradrenaline. So neurotransmitter level आमे कहि परिबा low level of norepinephrine is associated with depression, and mania is associated with excess level of noradrenaline. Another hypothesis has been also advanced to explain this bipolar disorder. that is indolamine hypothesis. Indolamine hypothesis suggests that low levels of serotonin, is low level of serotonin is associated with depression. And psychological factors, that is stress, is also there. And how can this bipolar disorder be treated? First, medication. Medications include mood stabilizing drugs, antidepressants, and atypical antipsychotic drugs. These type of drugs are given to a bipolar patient. And psychotherapy, especially cognitive behavioral therapy, family focused therapy, or psychoeducation, etc., are given. Then mood disorder due to general medical condition. Approximately 1 of every 10 major depressive episodes is caused by medical illness, substance abuse, or medication used to treat another disorder. Almost 1 of every 4 hospitalized medical patients has depressive symptoms. ताने से कहउचंदी हॉस्पिटल रे जते लोक जते पेशेंट अछंती तार 1/4 of them they suffer from depressive symptoms. Approximately 27 to 57% of patients with certain neurologic conditions develop symptoms of severe depression at some point during their illness. See condition गुड़ाक कौन ना Parkinson's disease, multiple sclerosis, Huntington's disease, epilepsy, etc. And these neurological diseases are associated with symptoms of severe depression at some point during the patient's illness time. And for medical conditions that do not directly affect the brain, prevalence rates appear to be more variable, ranging from less than 8% to 19%. 19% for coronary artery disease and 40% for primary hypothyroidism. And according to DSM-4-TR, the diagnosis of mood disorder due to general medical condition is done when the person has significant disturbance in mood that includes either or both of depressed moods or significantly reduced level of interest or pleasure in most or all activities. Mood is euphoric, heightened, or irritable. The person's symptoms are directly related to presence of a medical condition. Another disorder doesn't better explain the mood disturbance. The mood condition is not present only when the person is delirious. Otherwise, the symptoms are a cause of great distress to difficulty in functioning in important areas of life. Then let us discuss about schizophrenia. Schizophrenia is a severe psychotic disorder characterized by an array of diverse symptoms, including extreme oddities in perception, thinking, action, sense of self, and social interactions. Incidence केते frequently schizophrenia घटुची. The lifetime morbid risk for developing schizophrenia is estimated to be 1% to 1.5% in the United States. तेणु 1% by 1.5% of people develop schizophrenia during their lifetime. In India, according to NIMH, it is estimated that 4.3 to 8.7 million people suffer from schizophrenia. According to according to Borua, the prevalence rate of schizophrenia in India is 1%. Most cases of schizophrenia begin in late adolescence and early adulthood, though it is also found in childhood. Average age of onset is 25 years in males and 29 years in females. So, schizophrenia develop in late adult. Usually, it develop in late adolescence and early adulthood. However, childhood schizophrenia is also the cases of childhood schizophrenia are also found, and it is more common among males. The probability of developing schizophrenia increases if parents are also schizophrenic. ଯଦି ଜଣେ ପ୍ୟାରେଣ୍ଟଙ୍କର ସ୍କିଜୋଫ୍ରେନିଆ ଥିବ ତାହେଲେ probability of developing schizophrenia increases to 13%. जो आमर जनरल पॉपुलेशन आम कहे 1%, जदि गोटाए पेरेंट को भितर जनकर थिबो स्किजोफ्रेनिया ताहले से भली लोक मानकर प्रोबेबिलिटी ऑफ डेवलपिंग स्किजोफ्रेनिया इज 13%. And if both the parents are schizophrenic, this probability of developing schizophrenia in the offspring goes up to approximately 35%. Originally, schizophrenia रा symptom गुड़ाक जो 1810 रे जॉन हास्लाम बोली जने डॉक्टर बेथलाम हॉस्पिटल लंडन रे गोटे थिला से बेथलाम हॉस्पिटल ले से काम करूथिले सी बेथलाम हॉस्पिटल टा गोटे मेंटली रिटार्डेड गो पे गोटे हॉस्पिटल थिला इंस्टीट्यूशन ड्यूरिंग द 19th सेंचुरी आउ सेटा एभली भाव से ये थिला जे जो लोक माने लंडन बुली जाउथिले सेटा गोटे टूरिस्ट स्पॉट थिला आमे जेमती मने कर दिल्ली बुली गले कुतुब मीनार बुली जाउछे बा अन्य अन्य जगह देखिबा को बुलीबा को जाउछे एंड को जगह किसी पैसार टिकेट लगुची सेमती जो लोक मैंने लंडन जाउथिले से माने टिकट किणी बेथलाम हॉस्पिटल को देखिबा को जाउथिले सेठी मेंटली इल पेशेंट गुडा भारी कदर्य अवस्था रे थांती आ तांको देखिबा को लोक जाउथिले भाबुथिले से माने ओटे देखिबा जिनिस से जॉन हास्लाम से हॉस्पिटल ले स्किजोफ्रेनिया पेशेंट को ऑब्जर्व करी तार डिस्क्रिप्शन देथिले क्लिनिकल डिस्क्रिप्शन in 1896 I have told you the contribution of Kraepelin in the first class. Kraepelin gave a description of the disease, but Kraepelin करो description ने disease रो ना थिला dementia precox जोटा कि डिमेंशिया प्रिकॉक्स फीचर्ड मेंटल डिटेरियोरेशन बिगिनिंग अर्ली इन लाइफ. Swiss psychiatrist Bleuer in 1911 gave the nomenclature schizophrenia. 1911 ମସିହାରେ schizophrenia comes from two words. First, German word schizen, and the second is a Greek word Fren. Schizen means Schizen is a German word, and it means split, and Fren means mind. It was believed that there is a split in mind, mental split. And characteristics of schizophrenia. ଆମେ ଯଦି ଦେଖିବା ସ୍କିଜୋଫ୍ରେନିଆରେ କିଛିଟା ସିମ୍ପଟମ୍ ଥାଏ ପଜିଟିଭ ସିମ୍ପଟମ୍ କୁହାଯାଏ, ଆଉ କିଛିକୁ ନେଗେଟିଭ ସିମ୍ପଟମ୍ ବୋଲି କୁହାଯାଏ। ପଜିଟିଭ ସିମ୍ପଟମ୍ କ'ଣ? ପଜିଟିଭ ସିମ୍ପଟମ୍ସ ଡିନୋଟ୍ ଦି ପ୍ରେଜେନ୍ସ ଅଫ୍ ଗ୍ରସଲି ଆବନର୍ମାଲ ବିହେଭିଅର। ତାମାନେ ସେଇ ସିମ୍ପଟମ୍ ଗୁଡ଼ାକ ଆର୍ ପ୍ରେଜେଣ୍ଟ ଇନ୍ schizophrenic patients ଦେଖାଯାଏ। So the presence of these symptoms are positive symptoms. These include thought disorder, delusion and hallucination. ये तीनटा हला positive symptom of schizophrenia. Thought disorder is the diminished ability to think clearly and logically. Often it is manifested by disconnected and nonsensical language. Thought disorder, diminished ability to think. The patient cannot think logically. Second positive symptom is delusion. Delusions are erroneous beliefs firmly held despite contradictory evidence. That means disturbance in content of thought. Delusions, in delusions there is disturbances in content of thought.
Madam,
Yes.
Madam, delusion means false belief.
Yes. false belief ତ କହିପାରିବାନି, wrong belief, ଗୋଟେ ଭୁଲ erratic belief. ଓକେ, ତେଣୁ ଭୁଲ ଭାବରେ ସେ ଭାବୁଛି। ଆମର on the basis of the content of thought, delusion can be belief that one's thought and feelings are controlled by external agents. ସେ ଲୋକମାନେ କହୁଥିବେ ମତେ ଅନ୍ୟ ଲୋକ କଣ୍ଟ୍ରୋଲ କରୁଛି ମୋ ଭାବନାକୁ। thoughts are being broadcast, ଯାହାକୁ କହନ୍ତି thought broadcasting. Thought are being broadcast indiscriminately to others. For example, they may say that whatever I am thinking is broadcast, is being broadcast in televisions. ଟେଲିଭିଜନରେ ସବୁ ଲୋକମାନେ ଦେଖି ଦଉଛନ୍ତି ମୁଁ ଯାହା ଭାବୁଛି, ବା ରେଡିଓରେ ପ୍ରଚାର ହେଇଯାଉଛି ମୋ ଭାବନା ଗୁଡାକ। And thought intrusion. Thought intrusion is also there. Thoughts are being inserted into one's brain by external agency. ସେ ଅମୁକ ମୋ ମୁଣ୍ଡରେ ସେ ଭାବନା ଗୁଡାକ ଇଞ୍ଜେକ୍ସନ ଦେଇ ପଶେଇଲା ଭଳି ପଶେଇ ଦଉଛି। Thought withdrawal. One's thoughts are robbed by external agency. ମୋ ମୁଣ୍ଡରୁ ଭାବନା ଗୁଡାକ ନେଇଯାଉଛି ସେ ଚୋରେଇକିରି। delusion of reference. Delusion of reference ହଉଛି neutral environmental events have personal meaning for the patients. delusion of reference ମୁଁ ବୋଧେ ଗୋଟେ କହିଥିଲି schizotypal personality disorder ସେ ପେସେଣ୍ଟ ସେ ଲୋକମାନଙ୍କର ମଧ୍ୟ ଥାଏ, ଯୋଉଠି ଯାହା ଏନଭାରମେଣ୍ଟାଲ ନ୍ୟୁଟ୍ରାଲ ଇଭେଣ୍ଟ ଘଟିଲା ସେମାନେ କହନ୍ତି ଯେ ଏଇଟା ମୋ ପାଇଁ ଗୋଟେ ତାର ମେସେଜ ଅଛି, ସେ ଭଗବାନ ପରା ୟା ମତେ ଏଇ ଥ୍ରୁରେ ମେସେଜ ପଠଉଛନ୍ତି। ବା ମାନେ ସବୁବେଳେ ପର୍ସନାଲ ରେଫରେନ୍ସ ରହୁଛି, ତାର ମାନେ ପର୍ସନାଲ ସିଗ୍ନିଫିକାନ୍ସ ଗୋଟେ ସେ ମେସେଜର ସେ ଇଭେଣ୍ଟର ତା ପାଇଁ ରହୁଛି। ଡିଲ୍ୟୁଜନ ଅଫ ବଡିଲି ଚେଞ୍ଜେସ୍, କିଛି ଲୋକଙ୍କର ଏଇଭଳି ଡିଲ୍ୟୁଜନ ହୁଏ ଯେ delusions refer to removal of body organs, actually body organ ଥିବ କିନ୍ତୁ ମନେକର ମୋ ନାକଟା କିଏ ନେଇଯାଇଛି, ନାକ ନାହିଁ ମୋ ମୁହଁରେ, ଆଉ ଏଇଭଳି delusion of grandeur, delusion of grandeur ହେଉଛି delusion of possessing superior qualities such as fame, wealth or supernatural powers। ମୋ ଭଳି ମାନେ ପ୍ରସିଦ୍ଧ କେହି ନାହାନ୍ତି, ମୋ ଭଳି ମାନେ ଏବୁଲ କ୍ୟାପାବିଲିଟି ଥିବା ଲୋକ କେହି ନାହାନ୍ତି, ଏଇ ଟାଇପର ମୋର ଗୋଟେ ସୁପରନ୍ୟାଚୁରାଲ ପାୱାର ଅଛି, ମୁଁ ସବୁ ବଦଳେଇ ଦେଇପାରିବି, ଏଇ ଟାଇପର ଡିଲ୍ୟୁଜନ ଅଫ ଗ୍ରାଣ୍ଡିଅର। ମୁଁ ହେଉଛି ପୃଥିବୀର ରାଜା, ମତେ ଗୋଟେ ଇଏ ଥରେ ମୋର ଗୋଟେ ଏକ୍ସପିରିଏନ୍ସ ଅଛି, ସେ କହିଲା, ସେ ପଢ଼ୁଥିଲା ଯାହା, ମତେ ପରା ଏଇଠି ଏଇ କଲେଜରେ ଏମିତି ପଢ଼ିବାକୁ, ଏଇ କମ୍ବିନେସନ ନେଇକରି ପଢ଼ିବାକୁ ମତେ ପ୍ରିୟଙ୍କା ଗାନ୍ଧୀ କହିଲେ, ଆଉ ୟୁନେସ୍କୋର ଯିଏ ଅଛନ୍ତି ପ୍ରେସିଡେଣ୍ଟ ସିଏ ବି ମତେ କହିଲେ ଏଇଠି ପଢ଼ ବୋଲି, ସେଇଥିପାଇଁ ମୁଁ ଆସି ଏଇ କଲେଜରେ ନାଁ ଲେଖେଇଲି। ତ ଯେମିତି ମୁଁ ଗୋଟେ ଭାରି ପ୍ରସିଦ୍ଧ ଲୋକ ସେଇଭଳି। and delusion of prosecution ହେଉଛି delusional belief that others are going to harm oneself। ମତେ ମୋ ପଛରେ ଲାଗିଛନ୍ତି, ମତେ ବିଷ ଦେଇଦେବେ, ମତେ ମାରିଦେବେ, ଏଇଭଳି ଗୋଟେ ମୋର କ'ଣ କରି ପକେଇବେ। And another positive symptom is hallucinations. Hallucinations are perceptual disorders. ଆମେ ୟାକୁ କହିପାରିବା false perception. It is a sensory experience that occurs in the absence of external perceptual stimulus. Auditory hallucination is more common. ଶୂନ୍ୟରୁ ବାଣୀ ସବୁ ଶୁଭିବା, ତାଙ୍କୁ ଶୂନ୍ୟରୁ କଥା ସବୁ ଶୁଭେ। ବହୁ ସମୟରେ ଆମେ ମାର୍କ କରିଥିବା ସ୍କିଜୋଫ୍ରେନିକ ପେସେଣ୍ଟ ମାନେ ନିଜେ ନିଜେ କଥା ହେଉଥିବେ, ଯେମିତି ମାନେ ଗୋଟେ କନଭରସେସନରେ ଅଛନ୍ତି, ତାଙ୍କୁ ଲାଗେ ଜଣେ କିଏ କିଛି କହୁଛି, ତାଙ୍କୁ ଶୁଭେ, ସେଇଟା ହାଲୁସିନେସନ ହୁଏ। ତା ରିପ୍ଲାଇରେ ସେମାନେ ତାଙ୍କର ଯାହା କହିବା କଥା କହୁଛନ୍ତି। ଏସବୁ ଗଲା ପଜିଟିଭ ସିମ୍ପଟମ୍। ନେଗେଟିଭ ସିମ୍ପଟମ୍ କ'ଣ? ନେଗେଟିଭ ସିମ୍ପଟମ୍ସ ରିପ୍ରେଜେଣ୍ଟ ଦି ଆବସେନ୍ସ ଅଫ୍ ନର୍ମାଲ ବିହେଭିଅର। ଓକେ, ଆମର ପଜିଟିଭ ସିମ୍ପଟମ୍ ହେଲା ପ୍ରେଜେନ୍ସ ଅଫ୍ ଗ୍ରସଲି ଆବନର୍ମାଲ ବିହେଭିଅର, ଆଣ୍ଡ ନେଗେଟିଭ ସିମ୍ପଟମ୍ ହେଲା ଆବସେନ୍ସ ଅଫ୍ ନର୍ମାଲ ବିହେଭିଅର। ନେଗେଟିଭ ସିମ୍ପଟମ୍ସ ମାନେ ଯୋଉଟା ନର୍ମାଲି ଗୋଟେ ଲୋକର ଦେଖେଇବା କଥା ସେଗୁଡାକ ନଥାଏ, they are absent. These negative symptoms include flat or blunted affect, lack of emotional expression, ତାଙ୍କର କ'ଣ ତାଙ୍କୁ ଖୁସି ହେଲା, ଦୁଃଖ ଲାଗିଲା, କିଛି ତମେ ତାଙ୍କ ମୁହଁରୁ ଜାଣିପାରିବନି। ଧର ଯୋଉ ଆମେ ନର୍ମାଲି ଆମର ଜଣେ ଆମକୁ କିଏ କିଛି ଭଲ କଥା କହିଲା, ଆମେ ଖୁସି ହେଲେ ଆମର ମୁହଁରେ ସେଇଟା ଏକ୍ସପ୍ରେସନ, ଗୋଟେ ଫେସିଆଲ ଏକ୍ସପ୍ରେସନଟା ଚେଞ୍ଜ ହବ, ବା ଆମକୁ ଦୁଃଖ ଲାଗିଲା, ଦୁଃଖ ବି ଫେସିଆଲ ଏକ୍ସପ୍ରେସନ ୱିଲ୍ ଚେଞ୍ଜ। ବଟ୍ schizophrenic people, they show flat emotion, ତାଙ୍କର ଫେସିଆଲ ଏକ୍ସପ୍ରେସନ ଇଜ ନଟ୍ ଦେୟାର, ଇମୋସନାଲ ଏକ୍ସପ୍ରେସନ କିଛି ନାହିଁ, ଫେସିଆଲ ଏକ୍ସପ୍ରେସନ ଇଜ ଆବସେଣ୍ଟ। apathy ହେଉଛି ଗୋଟେ ଲସ୍ ଅଫ୍ ଇଣ୍ଟରେଷ୍ଟ, କୋଉଥିରେ ନାହିଁ। ଆଣ୍ଡ ସୋସିଆଲ ୱିଡ୍ରୟାଲ। ଆଭୋଲିସନ ହେଉଛି absence of motivation to goal directed activity। ଗୋଟାଏ କିଛି ଗୋଲ ଡାଇରେକ୍ଟେଡ, ଗୋଟେ କିଛି ଉଦ୍ଦେଶ୍ୟ ରଖି ଗୋଟେ କିଛି କାମ କରିବାକୁ ଯୋଉ ମୋଟିଭେସନ, ଦ୍ୟାଟ ଇଜ ଆବସେଣ୍ଟ। ଆଣ୍ଡ ଆଲୋଗିଆ ହେଉଛି absence of speech। नॉर्मली लोक मानको जहाँ ये से माने कहिबे कथा कहिबे करिवे किंतु स्किजोफ्रेनिक पेशेंट मानकर कथा ये बहुत ताकर कम एब्सेंस ऑफ स्पीच अनेक समय थाए विशेष कथबार्ता करंदिनी पचाले डायग्नोस्टिक क्राइटेरिया आम केमती कहवा स्किजोफ्रेनिया बोली 2 or more of the following each present for a significant portion of time during a 1 month period or less if successfully treated जदि मनकर से तार सिम्पटम देखा दौ दौ आमे ताकू ट्रीटमेंट देइथिबा ताले होय तो एई प्रकार सिम्पटम न थाई पारे किंतु माने 1 month रे से 5टा ये रु 2टा बा अधिका सिम्पटम थिबो कौन कौन से सिम्पटम फर्स्ट होची डिल्यूजन थिबो हालुसिनेशन डिसऑर्गेनाइज्ड स्पीच कथबार्ता रे किछि कोहेरेंस नथिबो ग्रॉसली डिसऑर्गेनाइज्ड और कैटाटोनिक बिहेवियर कैटाटोनिक स्टुपर भली हेकरी रहउथिबो एंड नेगेटिव सिम्पटम मध्य थिबो for a significant portion of the time since the onset of the disturbance, level of functioning in one or more major areas such as work, interpersonal relation or self-care is markedly below the level achieved prior to the onset. এই जो स्किजोफ्रेनिया स्टार्ट होबा आगुरु तार लेवल ऑफ फंक्शनिंग जहा थिला सेथिरु बहुत माने लेवलटा कमी जाइथिबो अफेक्टेड हेथिबो एंड continuous sign of the disturbance for at least 6 months अति कम रे 6 मास पई पूरा कंटिन्यूअसली एभली डिस्टर्बेंस थिबो जदि ता भीतर ट्रीटमेंट हेई थाए ताले होय तो कमी जाई थाई पारे न्यूरो कॉग्निटिव एक्सप्लेनेशन ऑफ स्किजोफ्रेनिया एटा हमें परे मु कहि करबी बहुत गुड़े आमर न्यूरो कॉग्निटिव पैराडाइम्स गोटे हैव बीन एडवांस्ड they are used to study patients with schizophrenia and with such paradigms the cognitive abnormalities in schizophrenia are characterized by means of experimental and clinical tests ame test करikiri clinical test देकरी ame जानि परिबा जे तारो कौन कौन सबू cognitive abnormality अच्छी and these techniques have indicated that some types of cognitive impairment are not only reliably present in schizophrenia but are also central and enduring features of the disorder. एटियोलॉजी आजिकली बेसी न्यूरोकॉग्निटिव मॉडल जो पैराडाइम टा देखुचंती एंड they are focusing on neurological changes in schizophrenic patients. Etiology, that means cause. Genetic vulnerability and environmental factors can act in combination to result in diagnosis of schizophrenia. तामाने हमरो डायथेसिस स्ट्रेस मॉडल seems valid to explain this. Research suggests that genetic vulnerability to schizophrenia is caused by interaction of several genes. बहुत गुड़े genes involved. Both individual twin studies and meta-analysis of twin studies estimate the heritability of risk for schizophrenia to be approximately 80%. तामाने जीन इफेक्ट केते बेसी हमें इथरु जानी परिबा concordance rates between monozygotic twins was close to 50%. ତାମାନେ ଯଦି ଟ୍ୱିନ୍ ଆଇଡେଣ୍ଟିକାଲ ଟ୍ୱିନ୍ ଅଛନ୍ତି ଆଣ୍ଡ ସେମାନଙ୍କର ଭିତରୁ ଗୋଟେ ପାର୍ଟନର ସ୍କିଜୋଫ୍ରେନିଆ ଅଛି ଆଣ୍ଡ ଆର ପେୟାରର ଆର ଲୋକଟାର ସ୍କିଜୋଫ୍ରେନିଆ ଥିବାର ଚାନ୍ସ 50%. Whereas dizygotic twins ଯୋଉଟା fraternal twin ସେମାନଙ୍କର concordance rate was 70%. Adoption studies have also indicated a somewhat increased risk in those with a patient with a parent with schizophrenia even when raised apart. ତେଣୁ ଆମର ଯୋଉ ହେରିଟାବିଲିଟି 80% ମୁଁ କହିଲି ଏତେ ବେଶୀ ସେ ପିଲାଙ୍କୁ ଗୋଟେ ପ୍ୟାରେଣ୍ଟର ସ୍କିଜୋଫ୍ରେନିଆ ଅଛି ପିଲାଟା ଯଦି ବି ମାନେ ଇଜ ରିଅର୍ଡ ଆପାର୍ଟ ଦେନ୍ ଅଲସୋ the probability of the offspring developing schizophrenia is very high. तार से बायोलॉजिकल पेरेंट संगे तार ये बहुत बेसी स्किजोफ्रेनिया पाई. So genetic vulnerability is very strong in schizophrenia. Fetal growth ऊपर मध्य रिसर्चर माने ये करचंती. Researchers have found that lower than average birth weight has been one of the most consistent findings, indicating slowed fetal growth, possibly mediated by genetic effects. से जो schizophrenic patient माने तांकर ये माने जन्म बेले तांकर बार्थ वेट बहुत कम थाए ताकू माने fetal growth was not optimum, possibly that is due to genetic effect. Hypoxia. It has been hypothesized that brain hypoxia or low oxygen levels before birth or at the time of birth or immediately after birth may be a risk factor for development of schizophrenia. So hypoxia may be causing some form of neuronal dysfunction or even subtle damage. Brain ने oxygen supply जदि आमर जतले fetal period रे before birth रे हेई थाउ बा ड्यूरिंग द प्रोसेस ऑफ लेबर जदि डिलेड लेबर हे बहुत समय रे ऑक्सीजन सप्लाई कमी जाए से समय रे हो बा बर्थ पर मध्य कोनोसी कारणरू ऑक्सीजन कम सप्लाई हैला ब्रेन को दैट makes a risk factor for the development of schizophrenia. कोन ऑक्सीजन सप्लाई कम हैलारू बा न हे पारू ब्रेन ने किछि न्यूरोनल डिस्फंक्शन बा चेंज होउची. Infections, numerous viral infections in the uterus or in childhood have been associated with an increased risk of later development of schizophrenia. These infections, viral infections include influenza, polio, measles, varicella zoster, rubella, herpes, etc. Or maternal genital infections. ଏଇଭଳି ଅନେକ ଗୁଡ଼ାଏ ଇନଫେକ୍ସନ୍ ମଧ୍ୟ ତାର କୋରିଲେସନ୍ ଅଛି ସ୍କିଜୋଫ୍ରେନିଆ ସାଙ୍ଗରେ. ତା ମାନେ ସମସ୍ତଙ୍କର ହବ ବୋଲି ମାନେ ନାହିଁ କିନ୍ତୁ ଅଛି ରିସ୍କ ଇଜ୍ ଦେୟାର. Substance use. There is a strong evidence that using certain drugs can trigger either the onset or a relapse of schizophrenia in some people. The rate of substance use is known to be particularly high in this group. In a recent study, 60% of people with schizophrenia were found to use substances. 37% would be diagnosable with a substance use disorder. ତାର ଡାଇଗ୍ନୋଷ୍ଟିକ୍ କ୍ରାଇଟେରିଆ ମିଟ୍ କରି ଯାଉଛନ୍ତି। ତେଣୁ ବହୁତ ସ୍କିଜୋଫ୍ରେନିକ୍ ବିଭିନ୍ନ ପ୍ରକାର ନିଶା ଅଭ୍ୟାସ ତାଙ୍କର ଥାଏ। ଅନ୍ ଦି ଅଦର ହ୍ୟାଣ୍ଡ ବହୁତ ଗୁଡ଼ାଏ ନିଶା ନେଲେ ସ୍କିଜୋଫ୍ରେନିକ୍ ସିମ୍ପଟମ୍ ମଧ୍ୟ ଟ୍ରିଗର୍ଡ ହେଇପାରେ। Cannabis doubles the risk of developing schizophrenia. Even ଯଦି ସ୍କିଜୋଫ୍ରେନିଆ ହେଇ ଟ୍ରିଟମେଣ୍ଟ ହେଇ ଭଲ ଟିକେ ଥିବ ତା ମଧ୍ୟ ନିଶା ଖାଇଲେ ପୁଣି ରିଲାପ୍ସ ହେଇଯାଇପାରେ। Amphetamines trigger the release of dopamine, and excessive dopamine function is believed to be responsible for many symptoms of schizophrenia. That is known as the dopamine hypothesis of schizophrenia. So, amphetamines may worsen schizophrenia symptoms. Amphetamines usually ଆମର ଯୋଉ ଡ୍ରଗ୍ ଗୁଡ଼ାକ ଷ୍ଟିମୁଲାଣ୍ଟ ଡ୍ରଗ୍ ଗୁଡ଼ାକ ସେଗୁଡ଼ାକ ଆମ୍ଫେଟାମାଇନ୍ ଇଏ ହୁଏ। ସେଗୁଡ଼ାକ ଆମ୍ଫେଟାମିନ୍ ନେଲେ ଡୋପାମାଇନ୍ ଆକ୍ଟିଭିଟି ବଢ଼ିଯାଏ ଆଣ୍ଡ ଡୋପାମାଇନ୍ ଆକ୍ଟିଭିଟି ଇଜ୍ ଆସୋସିଏଟେଡ୍ ୱିଥ୍ ସିମ୍ପଟମ୍ସ ଅଫ୍ ସ୍କିଜୋଫ୍ରେନିଆ। And we have a category of drugs, hallucinogens. ସେମାନେ ଆମର ପରସେପସନ୍ ବଦଳେଇ ଇଏ କରନ୍ତି। ଆମକୁ ତାକୁ କହନ୍ତି ସାଇକେଡେଲିକ୍ସ ଅର୍ ପରସେପସନ୍ ଅଲ୍ଟରିଂ ଡ୍ରଗ୍ସ, ହାଲୁସିନୋଜେନ୍ସ। ହାଲୁସିନେସନ୍ କ୍ରିଏଟ୍ କରେ। These drugs include ketamine, PCP, and LSD, etc. They used to mimic schizophrenia symptoms. କାହିଁକିନା ସେମାନେ ହାଲୁସିନେସନ୍ କ୍ରିଏଟ୍ କରନ୍ତି, ସେଇଥିପାଇଁ ତାଙ୍କୁ ହାଲୁସିନୋଜେନ୍ କୁହାଯାଏ। Sixthly, social adversity. The chance of developing schizophrenia has been found to increase with the number of adverse social factors. ଆମର ଷ୍ଟ୍ରେସ୍ ନିଶ୍ଚୟ ଥିବ, ତ ଡାଇଥେସିସ୍ ଷ୍ଟ୍ରେସ୍ ଗୋଟେ ଆଡଭର୍ସ ସୋସିଆଲ ବ୍ୟାକଗ୍ରାଉଣ୍ଡରେ ସ୍କିଜୋଫ୍ରେନିଆ ହବାର ଚାନ୍ସ ଥାଏ। Socio economic disadvantage or social exclusion present in childhood, stressful life events. Usually stressful life events precede the onset of schizophrenia. Stressful environment se lokor thibo, and childhood experience of abuse or trauma are risk factors for a diagnosis of schizophrenia later in life. Treatment. Treatment includes hospitalization. Hospitalization may occur with severe episodes of schizophrenia. ଅତି ସିଭିୟର ହେଲେ ହସ୍ପିଟାଲାଇଜେସନ୍ ଦରକାର। Medication is given. Antipsychotic medication can reduce the positive symptoms. ଆମର ଯୋଉ ହାଲୁସିନେସନ୍, ଡିଲ୍ୟୁଜନ୍ ଏଇ ସବୁ ଜିନିଷ ଗୁଡ଼ାକ କମେଇ ଦିଏ ଆଣ୍ଟିସାଇକୋଟିକ୍ ମେଡିକେସନ୍। ଦେନ୍ ଗୋଟେ ଲେବୁଲକୁ ନ ଆସିଲା ପର୍ଯ୍ୟନ୍ତ ସ୍କିଜୋଫ୍ରେନିକ୍ ପେସେଣ୍ଟ ପାଇଁ ହବ ମାନେ ସାଇକୋଥେରାପି ଦେଇ ହେବନି, କ୍ୟାନଟ୍ ବି, ୱିଲ୍ ନଟ୍ ବି ଇଫେକ୍ଟିଭ। କାହିଁକିନା ତାର ତ ଥିଙ୍କିଂ ଡିଜର୍ଡର, ତାର ତ ଏସବୁ ଥାଏ ଡିସଅର୍ଗାନାଇଜ୍ଡ ଇଏ, ସେ ଜିନିଷଟା ନ କମିଲା ପର୍ଯ୍ୟନ୍ତ, ଗୋଟେ ଇଏ ନହେଲା ପର୍ଯ୍ୟନ୍ତ କଗ୍ନିଟିଭ ବିହେଭିୟର ଥେରାପି ସାଇକୋଥେରାପି ୱିଲ୍ ନଟ୍ ବି ଇଫେକ୍ଟିଭ। ତାକୁ ତେଣୁ ପ୍ରଥମେ ମେଡିକେସନ୍ ଦେଇକିରି ଆମର ପଜିଟିଭ ସିମ୍ପଟମ୍ ଗୁଡ଼ାକ କମେଇବା ଦରକାର, ଗୋଟେ ତାର ମେଣ୍ଟେନ୍ କରିବା ଦରକାର ଗୋଟେ ଲେବୁଲ। ଦେନ୍ କଗ୍ନିଟିଭ ବିହେଭିୟର ଥେରାପି କ୍ୟାନ୍ ବି ଗିଭେନ୍, ଆଣ୍ଡ ମେଟା କଗ୍ନିଟିଭ ଥେରାପି ଟ୍ରେନିଂ ଏଗୁଡ଼ାକ ଆଜିକାଲି ୱେଷ୍ଟର୍ଣ୍ଣ କଣ୍ଟ୍ରିରେ ହସ୍ପିଟାଲ ରେ ଦିଆଯାଉଛି ଯେ ତାକୁ ହେଉଛି ଡେଫିସିଟ୍ ଇନ୍ ସ୍କିଜୋଫ୍ରେନିକ୍ ମାନଙ୍କର ମେନଲି ଡେଫିସିଟ୍ ଇନ୍ ମେଟାକଗ୍ନିସନ୍ ହେଉଛି ତାଙ୍କର ମେଟାକଗ୍ନିସନ୍ ମାନେ ଥିଙ୍କିଂ ଏବାଉଟ୍ ୱାନ୍ସ ଥିଙ୍କିଂ ଏବାଉଟ୍ କଗ୍ନିସନ୍ ବା thinking about one's cognitive processes. See, deficit in metacognition is responsible for tamara delusional beliefs. जो wrong belief गुड़ाक होची odd belief गुड़ा तेणु metacognitive training हॉस्पिटल गुड़ाक वेस्टर्न कंट्री रे दिया जाउची अछि कली then family therapy or education family member मानंकु मध्य they should be trained बहुत समय family member जो माने caretaker taking care of a schizophrenic patient is not a very easy task तांकर burn out हो जाए ये କରିବାକୁ ତେଣୁ ତାଙ୍କୁ ମଧ୍ୟ କେମିତି ହ୍ୟାଣ୍ଡଲ କରିବେ ଫ୍ୟାମିଲି ମେମ୍ବର ମାନଙ୍କୁ ପାଇଁ psychotherapy is essential as well as how to handle these patients in ବହୁତ ସମୟରେ ଆମେ ପେପରରେ ପଢିବାକୁ ପାଏ ଯେ ପାଗଳା ଥିଲା ତାକୁ ଗୋଡରେ ଚେନ୍ ବାନ୍ଧିକିରି ରଖିଛନ୍ତି ଘରେ ବନ୍ଦ କରିକିରି ରଖିଛନ୍ତି ତେଣୁ ସେଇଭଳି ଇନହ୍ୟୁମାନ ଟ୍ରିଟମେଣ୍ଟ ନ ଦେଇ କେମିତି ଇଏ କରିହେବ ସେଇ ଜିନିଷ ଫ୍ୟାମିଲି ମେମ୍ବରଙ୍କ ସାଙ୍ଗେ ଇଏ କରାଯାଏ ସୋ ଫ୍ୟାମିଲି ଥେରାପି ଅର୍ ଏଜୁକେସନ୍ ମାନେ ଏଜୁକେସନ୍ ଟୁ ଫ୍ୟାମିଲି ମେମ୍ବର୍ସ ଇଜ୍ ଅଲସୋ ଏସେନ୍ସିଆଲ then let us discuss about paranoid and delusional disorders. Paranoia means pervasive long-standing suspiciousness and generalized mistrust of others. आमे paranoid personality disorder विषय गला काली डिस्कस करथिले एटा paranoia होची गोटे generalized suspiciousness or mistrust paranoid people are hypersensitive and easily slighted they always search for clues to validate their prejudicial biases they tend to be guarded most of the time they are in touch with reality except for their misinterpretation of others motivation and intentions এই जो delusional belief जे अन्य माने कोन मोर अपमान करूचंती तांकर गोटे किछि मो पई क्षति करिवे सेही जिनिस गुडाकर ये छडा से मानकर रियलिटी टच प्राय थाए people suffering from this disorder are very difficult to deal with सब बळे संदेही लोक गुडा को तांको तम कथा तो से माने ट्रस्ट करिवेनी तणो तमे तांको की साइकोथेरापी दबो whether the patterns of distrust and suspicion begin in childhood or in early adulthood, they quickly come to dominate the lives of those suffering from the said disorder. तणु ये जो पैटर्न जनरल पैटर्न ऑफ डिस्ट्रस्ट dominates their life. Symptoms of paranoia symptoms kono na the main symptom is permanent delusion jo gote paranoid delusion it should be kept in mind that there is delusion in schizophrenia amaro schizophrenia re madhya delusion achi but in that case it is not permanent or organized विभिन्न प्रकार तांगर गोटे डिसऑर्गेनाइज्ड थिंकिंग हेकरे डिल्यूजन हुए बट इन paranoia the symptom of delusion appear gradually and here is a preoccupation with delusions frequent mane that is reflected by frequent complaining unfriendly with the trial or aloofness सब बेले से माने कई करबे कदा से अमुक मो पछरे लागि छी से समुक मोर क्षति करला समुक मते गुणी करला समुक मोर अमुक ई कर देला ତା ମାନେ ସେମାନଙ୍କ ସାଙ୍ଗେ ମିଶିବେନି, ଏଇ ଟାଇପ୍ର ଗୋଟେ ପ୍ରି ଅକୁପେସନ୍ ୱିଥ୍ ଡିଲ୍ୟୁଜନ୍, ଏଇ ଡିଲ୍ୟୁଜନାଲ ଥିଙ୍କିଂ। No disorganized behavior is can be marked. Preoccupied with unsupported doubts about friends or associates, suspicious, perceives attacks on his or her reputation that are not clear to others, and is quick to counter attack. କାହିଁକି ତତେ ତୋର ବଦନାମ କରିବେ ସେମାନେ, ବା କେତେବେଳେ କଲେ ବଦନାମ, ଏଗୁଡ଼ାକ ସେମାନେ ବୁଝେଇ ପାରିବେନି, କିନ୍ତୁ କାଉଣ୍ଟର ଆଟାକ୍ କରିବେ। ଆଣ୍ଡ ଅଦର ଅନ୍ୟମାନେ ବି କିଛି ସେ ବିଷୟରେ ବୁଝିପାରିବେନି କି ମାର୍କ କରିପାରିବେନି। Maintains unfounded suspicion regarding the fidelity of a spouse or significant other, reads negative meaning into innocuous remarks, reluctant to confide in others due to fear that information may be used against him, self-referential thinking. Self-referential thinking says ideas of reference ମୁଁ କହିଥିଲି, ଏଟା କ'ଣ ନା sensing that other people in the world are always talking about the paranoid individual. Thought broadcasting is also found in these patients. Magical thinking, they think that they can use their thoughts to influence other people's thoughts and actions. And thought withdrawal, the sense that people are stealing the paranoid individual's thoughts. Thought insertion, ଏଗୁଡ଼ାକ ସବୁ ସ୍କିଜଏଡ୍ ଇଏଙ୍କର ଡିଲ୍ୟୁଜନରେ ଥିଲା। ବେଶୀ ଏଗୁଡ଼ାକ ଦେଖାଯାଏ ପାରାନଏଡଙ୍କର, ଏଇ ଯେଉଁ ଥଟ୍ ୱିଡ୍ରୟାଲ, ଥଟ୍ ଇନସର୍ସନ୍। କାହିଁକିନା ସେମାନେ ସନ୍ଦେହ ସବୁବେଳେ କରନ୍ତି ନା, ମୋ ଭାବନା ଗୁଡ଼ାକୁ ସେ ଚୋରି କରି ନେଇଗଲା। ମୁଁ ନୋବେଲ ପ୍ରାଇଜ୍ ପାଇଥାନ୍ତି, କିନ୍ତୁ ମୋ ଆଇଡ଼ିଆ ଗୁଡ଼ାକ ପରା ସେ ସାଇଣ୍ଟିଷ୍ଟ, ଅମୁକ ସାଇଣ୍ଟିଷ୍ଟ ନେଇଗଲା। Kinds of paranoia. Paranoia can also be of several types. Persecutory paranoia. Persecutory paranoia is the most prevalent type of paranoia. It believes that the patient believes that all those around him are his enemies, and they are trying to harming him, or even taking are thinking of taking his life. And due to this delusion, people, the patient becomes of an aggressive temperament, often terms dangerous killers. ସେ କାଳେ ମତେ ମାରିଦବ ବୋଲି ମୁଁ ତାକୁ ମାରିଦେଲି, ଏଇଭଳି ଯୋଉ। And religious paranoia. Religious paranoia, the person believes that he or she is the messenger of God who has been sent to the world to propagate some religion. Reformatory paranoia. In this, the patient considers himself a great reformer. ଗୋଟେ ବଡ଼ ସମାଜ ସଂସ୍କାରକ ଆସିଲା। Erotic paranoia. Here the patient often tends to believe that members of the opposite sex, usually belonging to an illustrious family, want to marry him or her. Such people even write love letters and thereby cause much botheration to other people. ସେ ଭାବନ୍ତି ଯେ ଅନ୍ୟମାନେ ସବୁ ତାକୁ ବାହା ହେବାକୁ ପଛରେ ପଡ଼ିଛନ୍ତି, ତାକୁ ଭଲ ପାଇବାକୁ ତା ପାଇଁ ପଛରେ ପଡ଼ିଛନ୍ତି, ଏଇଭଳି। Litigious paranoia. In this kind, the patient takes to filing meaningless cases against other people. କିଛି କାମ ନଥାଏ, ଗୋଟେ ମିଛ କେସ୍ ଫାଇଲ୍ କରନ୍ତି, କାହିଁକିନା ସେମାନେ ଭାବନ୍ତି ଯେ that other people is trying to bother him or harm him. ସେ ମୋ ପାଇଁ ପଛରେ ଲାଗିଛି, ସେଥିରୁ ମୁଁ ଫାଇଲ୍ କରିବି କେସ୍। And lastly, hypochondriacal paranoia. Sorry. In this kind, the patient believes that he or she is suffering from all kinds of ridiculous diseases. ହାଇପୋକଣ୍ଡ୍ରିଆସିସ୍ ବିଷୟରେ ଆମେ ଡିସ୍କସନ୍ କରିଥିଲେ। ଯେମିତି ଗୋଟେ ପ୍ରି ଅକୁପେସନ୍ ଯେ ମୋର ଗୋଟେ କ'ଣ ବଡ଼ ରୋଗ ହେଇଯିବ, ଏମାନଙ୍କର ସେମିତି ଗୋଟେ ଡିଲ୍ୟୁଜନ୍ ଥାଏ ଯେ they are suffering from all kinds of diseases, and also that some other people are to be blamed for his or her suffering. ମୋର ତ ବେମାରୀ ଅଛି ସବୁ, I am suffering from ବେମାରୀ and my ବେମାରୀ is caused by other people. ଅନ୍ୟ ଲୋକମାନେ ମୋର ବେମାରୀ କରିଦେଉଛନ୍ତି। Causes of paranoia have been found to be homosexual fixation, Freud କହୁଛନ୍ତି, feelings of inferiority, hereditary contribution is also there, role of neurotransmitters are there, environment is responsible, alcohol and drug abuse ଅଛି, dysfunctional cognitive processing, medical causes କେତେ ଗୁଡ଼ାଏ, ଅନ୍ୟ କେତେ ଗୁଡ଼ାଏ ଡିଜିଜ୍ରେ ଏମିତି ଡିଲ୍ୟୁଜନ୍ ହେଉଛି, and associated mental illnesses, ଅନ୍ୟ କିଛି mental illness ଥାଇକରି ମଧ୍ୟ ଇଏ ହେବ। Then delusional disorder. Delusional disorder ହେଉଛି unlike most other psychotic disorders, the person with delusional disorder typically doesn't appear obviously odd, strange or peculiar during periods of active illness. ତାକୁ ଜଣା ପଡ଼ିବନି, yet the person might make unusual choices in day-to-day life because of the delusional beliefs. ତାର ଡିଲ୍ୟୁଜନ୍ ଥାଏ, ସେଇ ଯୋଗୁରୁ ସେ ତାର day-to-day ଲାଇଫ୍ରେ ବହୁତ unusual ଜିନିଷ ଦେଖାଏ। For example, they may believe that they are under government scrutiny and ସେଇ ଭୟରେ, ତାଙ୍କର ସେଇ ଭୟ ଯେ ସବୁବେଳେ ସରକାର ମୋ ପଛରେ ଲାଗିଛନ୍ତି, ସେଇଥିପାଇଁ ମୋ ଟେଲିଫୋନ୍ ନେଲେ ସରକାର ଜାଣିଯିବେ ମୋର କଥାବାର୍ତ୍ତା କାହା ସାଙ୍ଗେ କ'ଣ ହେଉଛି, କ୍ରେଡ଼ିଟ୍ କାର୍ଡ଼ ନେଲେ ଜାଣିଯିବେ ସରକାର କ'ଣ ଖର୍ଚ୍ଚ କରୁଛି, କେତେ ପଇସା ପାଉଛି, ତେଣୁ କ'ଣ କାହା ସାଙ୍ଗରେ ଇଏ ହେଉଛି। ତେଣୁ ଏଇ ପ୍ରକାର ବିହେଭିଅର ଗୁଡ଼ାକ ବିକଜ ଅଫ୍ ଦେୟାର ଡିଲ୍ୟୁଜନାଲ ବିଲିଭ୍ସ, they attribute any obstacle or problems in functioning to the delusional reality. ତାଙ୍କର ଯାହା ସେ ଭାବିଥିବେ ସେଇ ଇଏରେ ଯାହା ସବୁ ହେଉଛି ସେଇଥିପାଇଁ ଆଉ। Then psychotic disorder due to general medical condition. ମେଡିକାଲ କଣ୍ଡିସନ୍ ସବୁ ଯୋଗୁରୁ ଅନେକ ସମୟରେ ସାଇକୋଟିକ୍ ସିମ୍ପଟମ୍ସ ମଧ୍ୟ ଦେଖା ଦେଇଥାଏ। ସଚ୍ ମେଡିକାଲ କଣ୍ଡିସନ୍ସ ଦ୍ୟାଟ୍ ମେ କଜ୍ ସାଇକୋସିସ୍ ହେଉଛି ବହୁତ ଭେରିୟସ୍ ନ୍ୟୁରୋଲୋଜିକାଲ ଡିଜର୍ଡର୍ସ ଆର୍ ଦେୟାର, ପାର୍କିନସନ୍ସ ଡିଜିଜ୍, ଆଲଜାଇମର୍ସ ଡିଜିଜ୍, ଏଇଭଳି ସେଗୁଡ଼ାକ ହେଲେ ଆମର ସାଇକୋଟିକ୍ ବିହେଭିଅର ଦେଖା ଦେଇପାରେ। ଦେନ୍ ଏଣ୍ଡୋକ୍ରାଇନ୍ ଡିଜର୍ଡର, ଆମର ଏଣ୍ଡୋକ୍ରାଇନ୍ ଗ୍ଲାଣ୍ଡର ଯେଉଁ ହରମୋନ୍ ଇଏ ହୁଏ, ସିକ୍ରେସନ୍ ହୁଏ, ତାର ସେଥିରେ ଇମ୍ବାଲାନ୍ସ ହେଲେ ମଧ୍ୟ ସାଇକୋଟିକ୍ ବିହେଭିଅର ଇଏ ହେଉଛି। ଏମାନଙ୍କର ବେଷ୍ଟ ଏକ୍ଜାମ୍ପଲ୍ ହେଉଛି ଆମର ଥାଇରଏଡ଼ ଇମ୍ବାଲାନ୍ସ। ଥାଇରଏଡ଼ ଇମ୍ବାଲାନ୍ସ ହେଲେ ଆମର ଏମିତି ଡିଲ୍ୟୁଜନ୍ ଇତ୍ୟାଦି ହେଇପାରେ। ତେଣୁ ଦି ପର୍ସନ୍ ମେ ଆପିୟର ସାଇକୋଟିକ୍। ଇନଫେକ୍ସନ୍ସ, ଅନେକ ଗୁଡ଼ାଏ ଇନଫେକ୍ସନ୍ ଯୋଗୁରୁ ମଧ୍ୟ ବ୍ରେନ୍ରେ ଇନଫେକ୍ସନ୍ ହେଲେ ଆମର ବିହେଭିଅର ଚେଞ୍ଜ ହେଇଯିବ। ଫର ଏକ୍ଜାମ୍ପଲ୍ ଏନକେଫାଲାଇଟିସ୍, ମେନିଞ୍ଜାଇଟିସ୍, ଏସବୁ ମେନିଞ୍ଜାଇଟିସ୍ ଇଜ୍ ଦି ଇନଫେକ୍ସନ୍ ଅଫ୍ meninges ହଉଛି ତମର outer covering of brain, just skull ଆଉ brain ମଝିରେ ଯୋଉ brain covering ଟା ସେଇଟା meninges। ତାର ଇନଫେକ୍ସନ୍ ଏଇ ସବୁ ଇଏରେ ଅବଭିୟସଲି ବ୍ରେନ୍ ସବୁ କଣ୍ଟ୍ରୋଲ କରୁଛି ମାନେ ଆମର ସିମ୍ପଟମ୍ ଗୁଡ଼ାକ ଦେଖାଦବ ଇନଫେକ୍ସନ୍ ହେଲେ। ସୋଡ଼ିୟମ୍ ଇମ୍ବାଲାନ୍ସ ହେଲେ ମଧ୍ୟ ଲୋକ ଡିସୋରିଏଣ୍ଟେଡ୍ ହେଇ ଇଆଡ଼ୁ ସିଆଡ଼ୁ ବିହେଭିଅର ଦେଖେଇଥାଏ। ଭିଟାମିନ୍ ଡେଫିସିଏନ୍ସି, କେତେ ଗୁଡ଼ାଏ ଭିଟାମିନ୍ ଡେଫିସିଏନ୍ସିରେ ମଧ୍ୟ ସେ ସାଇକୋଟିକ୍ ଇଏ ଦେଖାଦିଏ। And drug and alcohol use, we have already discussed ବହୁତ ଗୁଡ଼ାଏ ଡ୍ରଗ୍ରେ ଆମର psychotic symptoms देखा दिए। So I think we should stop here. If you have any doubt,
Excuse me, ma'am. I
Yes.
have sent my mail ID yesterday. So please send this PDF to me.
okay.
Okay. Okay.
କାହାର କିଛି ଆଉ ଡାଉଟ୍ ଅଛି?
No, ma'am.
Okay, thank you. ଠିକ୍ ଅଛି, I will send it to you.
Okay, ma'am. Thank you.
Okay. Wish you all the best.
Thank you, ma'am.